Tonight we are having a great conversation with Dr. Lee, Pediatric Infectious Disease Physician up at UVM's Children's Hospital, and Karen Vastine is Senior Community Relations Officer at UVM Health. I am joined this evening by Wei Wang of the Vermont Health Equity Initiative and the Vermont Professionals of Color Network, and I am Luis Calderon, also of the Vermont Health Equity Initiative and the Vermont Professionals of Color Network. The VHEI, as we call it, is a community partner organization managed by our overarching group, the Professionals of Color Network, dedicated to the health of Vermont's Black, Indigenous, people of color, and the BIPOC community. Our mission is addressing racism as a public health crisis and reducing disparities across public health outcomes in Vermont. The Health Equity Initiative presently leads some of the COVID-19 vaccination clinics in Chittenden County, and our goal and mission is to provide safe, dedicated, and community-focused environments and resources for COVID-19 education and vaccination for Vermont's BIPOC community. And so with that, I would love to turn this session over to my good friend, Karen Vastine, to take us through this evening's presentation.
So Dr. Lee and I are here. I think in the interest of full disclosure, we are both, working in the healthcare field, and as such, we are very much wanting to encourage people to get the vaccine. That said, the point of this session is to give you the information that you need to be able to make decisions for yourselves and for your family. But I always like to start off by at least sharing that we're pretty pro-vaccine. So without further ado, if there aren't initial questions, I think what we'd like to do is to pivot to the PowerPoint, and we'll get that rolling. But that said, we're an informal group, and feel free to ask questions as we're going along. So Dr. Lee, are you ready?
I'm ready.
Okay, so welcome. And am I showing a protected view? Are you guys seeing what you need to see here? Okay. This is Dr. Lee. And protecting young Vermonters with COVID vaccines.
All right, thanks. Well, first, thanks for this opportunity for allowing me to be here and to discuss COVID-19 vaccines and youth. As Karen mentioned, I am certainly pro-vaccine as a pediatric infectious diseases physician. My mission is to try to help all of our children live long, healthy, and happy lives. And I think vaccination is a critical part of their health and wellness. So again, just in full disclosure, I definitely am a fan of vaccines, but it's critically important for us to have an honest discussion and for everybody to have access to scientifically accurate information when making these decisions for themselves or for their family. Yeah, so here is sort of the agenda for our initial discussion tonight. Just a very brief overview of what we've been seeing with COVID-19 in Vermont children. But really the meat of this discussion will be presenting some information about the vaccines themselves and how they apply to children and adolescents. And then at the end, there will be some more practical information about how to sign a child up for vaccine and the process for the BIPOC COVID-19 vaccination clinics as well. And certainly at any time, if folks have questions or there's a topic that people are interested in discussing more, then like we said, we can make this quite informal. Next slide, please. Okay, so here's where we are right now. This is the latest weekly data tracking COVID-19 cases among Vermont's school-aged children. So if we go across the bottom, you'll see this is just giving dates, showing the chronology of the pandemic over the last fall and winter into the spring. And what we see is we have the number of cases broken down according to different color-coded categories, and high school kids versus middle school age kids versus elementary school kids. And what we don't have here are the case numbers in adults, but if we were able to superimpose the rate of infection of COVID-19 in adults in Vermont, what we would see is that these match almost exactly. So very little infection last summer and into the fall. But as weather got colder, folks started moving indoors. And we got into the winter here, just like everywhere else in this country, we saw a pretty significant surge of infections. Fortunately, what you'll notice is now over the last month and a half, those infection rates have really taken a nosedive. And a lot of that can probably be attributed to the rollout of vaccination in older individuals, thus protecting their children or protecting children that they may be around. So it still remains the case that almost without exception, children who catch COVID-19 catch it from an infected family member or adult. When we get into the teenage years and the high schoolers, then there may be some more transmission amongst the teens, but certainly for younger children, it's going to be from a very close contact, usually an adult in the family or household. And we present these data just to underscore the fact that while it is true that children do appear to be less susceptible to catching COVID-19 than adults, and are less at risk for the most severe types of illness, we have been seeing COVID-19 in Vermont's children. Again, we think we've been very successful in the state in balancing infections with other activities that children need, such as school attendance. And so while rates are low and while the risk of infection to a child, any individual child, is low, we definitely have been seeing infections in Vermont children. And one of the more sobering things is that as we've been moving further along and as we've been seeing more and more children with COVID-19, it does appear that children can get this so-called long haul COVID syndrome. That appears to be the case. And as we've saw previously, children have this very rare complication known as multi-inflammatory, multi-system inflammatory syndrome associated with COVID. That's very rare, but is a severe manifestation of COVID-19. So while it's rare, it is something that it's important to protect our children from getting. Next slide, please. And so that brings us to why vaccinate your teen. So the quick answer, the initial answer is, of course, we want to protect all of our children from catching COVID-19 so they don't get sick. A lot of folks might counter that with, well, we've heard that when kids get it, they don't really get very sick. So are there other benefits just other than protecting them from catching COVID-19? And what I would argue is that, number one, as I just mentioned, most children don't get very sick, but there are some children who unfortunately do have these longer term bad outcomes, such as MIS-C or long haul COVID. But really, from a very practical standpoint, right now, the benefits for teens and kids to getting vaccinated in terms of what it will do for them in terms of their lives right now, what they can do, and the quality of life right now is pretty astounding. Over the past winter, children and teens have been under the same restrictions as adults in terms of needing to quarantine if they were exposed, having far more limited options in terms of activities and events, and being able to just be with loved ones and friends. And so when we vaccinate folks, and we see the guidance sort of being rolled back all over, what we realize is that when we get vaccinated, we don't need a quarantine after exposure, and that gives us a lot more freedom. We can see our friends, we can see our loved ones without worrying about either catching COVID or transmitting it to somebody that we care about. So that means we can now start to do all of these things that kids should be free to do: socialize, travel, play sports. and really just get back to life as we knew it. And I sincerely believe we can't get back to that point until we can get as many people vaccinated, and that includes our kids. So really briefly, if we talk about the different types of vaccines, so in the United States, there are 3 different vaccines that are currently able to be used under what's known as an emergency use authorization by the US Food and Drug Administration. The first is the vaccine made by Pfizer. This is a 2-dose series, and the doses are given 3 weeks apart. The next one is made by Moderna. This is also a 2-dose series given 4 weeks apart. And the last one is the vaccine made by Johnson & Johnson, which is 1 shot. When it comes to our youth, right now, really the only vaccine that we're able to talk about is the Pfizer vaccine. So the Pfizer vaccine is the only one approved for teens down to the age of 12. Both Moderna and Johnson & Johnson are in the process of performing clinical trials looking at their vaccines in younger children as well. But right now, for the ages 12 and up, Pfizer is currently the only option, although I certainly expect that we are going to have some additional options coming soon. It first was authorized in December of 2020, and their initial authorization was for patients aged 16 and up. So even when the authorization first went into effect, there was a narrow window of younger kids, 16 through 18, that were eligible for this vaccine that weren't eligible for the others. Now, the exact same vaccine, same dose, same schedule, has now been authorized for use in youth ages 12 through 15, and that authorization went out just a week ago. Currently, the BIPOC clinics are using only Pfizer vaccine. And so again, the rest of this talk really is going to focus most on Pfizer. For younger Vermonters, as I mentioned, unfortunately, we don't have any options that are approved. There are multiple clinical trials in progress evaluating them in younger kids. And Pfizer has already indicated that they hope that in September, they will have the data that they need, that they'll need to be able to submit to the FDA an application to extend the emergency use authorization to kids younger than 12. So what that means is, practically speaking, children 12 and above, there's no reason why we can't get all of them vaccinated before the next school year. For kids 12 and under, we're hoping that sometime this fall is when the vaccine will be available to them. Okay. And so just to talk a little bit about vaccines in general, this vaccine works very similarly to other vaccines that your child may have already received. Really, the point of any vaccine is to train the body to stop a pathogen, to stop a germ when it sees it. And for this particular vaccine, it's designed to stop SARS-CoV-2, the virus that causes COVID-19. And the way that the vaccine does this is it helps your body develop antibodies that will then recognize and neutralize the virus if your child is exposed. And what that means is, after getting vaccinated, your body will make these antibodies, or your child's body will make these antibodies, and will keep your child protected from getting COVID-19. Number one, it'll help protect them from getting infected, period. But then number two, if they do manage to somehow get an infection, that's what's known as a breakthrough infection, an infection somebody who had been vaccinated, we know that it does a terrific job at keeping them from getting very sick with it. So they may have completely asymptomatic infection, or at worst, a very mild infection following vaccination. How well do the vaccines work? The vaccines work tremendously well. When the vaccine was tested specifically in 12 to 15-year-old children, not a single child in the trial who received the vaccine got COVID-19. So you can't really get any better than that when we talk about how well a vaccine works. Just in general, these vaccines, not just the Pfizer vaccine, but all of the vaccines, really shattered all expectations that that we in the medical field and in the scientific community had for how well we thought that they would work initially. We expected that they would work, but all of us were blown away with how well these vaccines work. And I think it's hard, or it's important for me to reiterate that. That's something that I try to emphasize all the time. I'm a specialist in infectious diseases, and I'm a medical researcher as well. And these vaccines truly just shattered all expectations we had. That's how well they work. We know that they give us at least 6 months of protection, probably longer. The virus has only been with us for a little over a year, so there's still going to be a lot of work ongoing to see, will booster doses be needed? If so, how frequently? That sort of thing. But what we know now is that if you get the vaccine, you are very, very well protected for quite a long time. And I can say that with utmost confidence. So how do we know that COVID-19 vaccines are safe for youth? And that, of course, is one of the most important questions we have whenever we're talking about medicines or vaccines for our children. How do we know that they're safe for our kids to take? With these vaccines, when we look at specifically young people, they were tested on thousands of young people to demonstrate their safety. In the original clinical trials, when the drug companies first looked at people of all ages, they were tested on tens of thousands of people. And since they've been approved, they have been safely used now. It says tens of millions of people. In fact, at this point today, it's probably now hundreds of millions of people. So we have a huge amount of clinical experience already with these vaccines. Many medical and federal agencies have all been looking at the vaccines to make sure that they continue to be safe post-approval. And the CDC, Centers for Disease Control, says, and I completely agree that this is going to be the case, these are probably going to be the most closely scrutinized vaccines in history, just because we know how big the problem is, the COVID-19 pandemic, and we know what's at stake. We need to stop the pandemic. And right now, these vaccines are absolutely the way that, the tool that we have to do this. And what that means is, as these vaccines get used throughout the world, and not just in the United States, but elsewhere, they really are going to be the most heavily scrutinized and most intensely analyzed vaccines in terms of safety that I think we've ever seen. So really what we're going through in many ways, in more ways than one, is completely unprecedented. Not only in terms of, unfortunately, living through a global pandemic, but how this is going to sort of change how we do vaccines and monitor vaccines as well. Now, it is fairly common for people to have some mild side effects when they get vaccinated. That doesn't mean everybody will have side effects. A lot of people don't have any side effects at all. But in the studies that were done, the most common side effects for children 12 and above were the same side effects that were reported in adults. Frequently, low-grade fever was seen, some chills, headache, fatigue, nausea, and muscle aches, particularly pain around the injection site. These were the most common side effects that we're seen in vaccine recipients of all ages. And so we do expect that when our kids get vaccinated, they may have some of these side effects as well, but they're generally very short-lived. They usually go away after, in most cases, just a day, although in some cases it may take a couple of days. And really, all that anybody needs to sort of get over this is just making sure they're resting, drinking plenty of fluids. If they do have fevers and it would make them more comfortable to take a medicine to reduce their fever, then certainly that's perfectly reasonable. And just like for anything else, if there's any concern, then certainly Vermont's pediatricians are very eager to hear from families, because that way they know that their child, that one of their patients and your child has gotten a vaccine. And so we know in the pediatric community in Vermont, this has been really the topic that we can't stop talking about, how excited we are for our kids and for our teens to start getting vaccines. And we're just so thrilled that we're actually starting to see this roll out. And even if that does mean a call here or there saying, hey, my child got a vaccine and now has a little bit of fever, is that okay? The answer is definitely yes, that's okay. We do think that it will happen as a side effect, but they're very temporary, they're very short-lived, and they go away. And the benefit is we know your child really has very little to worry about from COVID once they complete the vaccination series.
I'll take it from here, Dr. Lee.
Okay.
Or about the registration. Thank you so much for all of that information. So in terms of signing up your teen for the BIPOC vaccination clinics, we are open every Saturday until about July 10th at this point. This Saturday from 1 to 5 p.m. and May 29th from 1 to 3:30 p.m. June dates will be held also on Saturdays. The times will be listed on our website at vermonthealthequityinitiative.org. So we are also accepting both registrations and walk-ins. In terms of registration, please visit our website for more information and to sign up. You can also register via the state website, and that will, both of those, both the website and the state registration site will have the times that are currently available. And if you register through our website, we will be reaching out for a confirmation to you directly. So. In terms of parental permission, parents do need to give their permission for kids ages 12 to 17. So within our registration system through the state registration system, you'll be able to provide consent right away via the website. If you do register through the BIPOC vaccination registration process, there is not currently a consent process. So we do ask that you come with your teen to the clinic so that you can sign those consent documents.
So a common question that comes up is, are children eligible to get the vaccine, or is somebody eligible to get the vaccine if they have allergies? And right now, it's important for everybody to note that having allergies does not disqualify anybody, including your child, from getting the vaccine. The only allergy that would make the vaccine contraindicated, meaning they can't get it, is if somebody has an allergy, developed a severe allergic reaction to the vaccine itself, or a component of the vaccine. And the list of components in the vaccine that people could be allergic to is very narrow. So having, for example, severe environmental allergies, or allergies to, for example, to use myself as a personal example, I have allergies to wasp venom. And so I have to carry an EpiPen in case I get stung by a wasp. Those types of allergies are perfectly fine. And I certainly didn't hesitate to get my vaccine because of those types of allergies. If your teen has in the past ever had a severe allergic reaction to a vaccine or a medication, that's something that would need to be reported at the time of vaccination. And usually whoever's administering the vaccine, there's sort of a checklist of questions that they would go through with everybody. And that's typically one of them. The only difference is that they may ask you to sit and be monitored for 30 minutes instead of 15 minutes, which is sort of the standard length of time for people who answered no to that question. And in terms of how long it takes for people to become protected, we know that to get full protection, meaning the maximum benefit from the vaccine, it takes about 2 weeks after getting the second dose. And we know that just based on the clinical trials data, that's sort of the sweet spot. Once somebody is 2 weeks out following the second dose, then you're as protected as you will ever be. That doesn't mean that you don't get any protection before that time point. It's just that we know that you need to get that second dose and a little bit of time since that second dose to sort of max out in terms of the protection that you've received. What that means, though, is until your child is fully protected, we do believe that they need to continue to wear masks, because as we started the presentation off with, we are seeing that there is some COVID-19 affecting our kids, and we want to make sure that we protect all of our children as best we can. So that does mean continuing with masks until all our kids are fully protected.
Our clinics do offer multilingual resources such as in-person interpretation, and we also offer teletranslation, meaning we call an interpreter by phone and offer translation by phone. There are paper copies of all of the documentations as well in various languages that are accessible through our website at vermonthealthequity.org. All of the resources are available there. So if you have any questions, please let us know.
So to summarize, the Pfizer vaccine that we have available for our teens 12 and up is extraordinarily effective. I can't emphasize that enough. It is such a great vaccine. It is safe and free and available now. And just as a reminder, when we get our teens vaccinated, that means that they can take their lives back. They don't have to quarantine if they have an exposure. Once again, families can begin to travel and do a lot of those things that we love to do, but haven't been able to for so long due to the pandemic. So at the end of the day, not only will the vaccine keep you and your family, our children, fully protected from COVID-19 and all the risks that involves, it will help us all get back to life as we know it, and help us get back to normalcy. So please, I encourage you and your children, or eligible children, to sign up now and get your vaccine as soon as possible if you hadn't had a chance to do that yet. All right, and thank you so much for your attention. Hopefully we were able to provide some useful information for you, and we'll be happy to take any questions that anybody might like to ask.
I have a question. So in our clinics, we've gotten some folks, even before the 12 to 15 allowance came to be, about vaccinating children. So when it was 16 plus, who were a few months shy or a few weeks shy of their birth date. So similarly for children who are still technically 11 years old, but they're maybe a couple weeks away. Is it okay for them to get the vaccination? What are the regulations around that, and why are they?
Yeah, so one, I think it's fantastic to hear that that there are so many families who are so eager to get their kids vaccinated that they're bringing them in early. Unfortunately, I think that until we have clinical trials data and an FDA authorization for kids below 12, that they are going to have to wait until they hit their birthday. That's just really the only way we can ensure that we're being as careful as possible, and that we know for sure that we've done everything, we've done all of our due diligence to know that it's absolutely safe for this child to get the vaccine. So I'm thrilled to hear that there are families who are eager, but just a little bit, we're going to need to exercise just a little bit of patience for the younger kids.
Walter, Jolie, do you have any questions?
Hi, can you hear me okay?
Yes.
Great. Oh, well, thank you so much for this presentation. I was curious about in September when we can expect the vaccine to be distributed to those younger than 12. Do we know what age range they're looking at?
So that's a great question. The studies that are ongoing have multiple age brackets. So usually when new vaccines are tested, they undergo what's known as an age de-escalation strategy, where they're tested in successfully younger and younger cohorts. So it wouldn't necessarily be all children, say 6 months to 12 years all at once. Off the top of my head, I do not know exactly how those brackets are broken down, whether it's 10 to 12 or 8 to 12 or 6 to 12 and 1 to 5. And so that is a great question. It really depends on what the clinical trials data show in terms of how quickly they were able to reach their target enrollment and analyze the data. So unfortunately, I think we're just going to have to wait and see a little bit to know exactly what ages end up ultimately getting included in that initial extension for the EUA.
Thank you. And that's Pfizer looking into that. No other vaccine just yet?
Well, the other vaccine manufacturers, both Moderna and Johnson & Johnson, are doing trials in adolescents and younger children as well. As far as I'm aware, Pfizer is the only company that has actually, come out publicly and said, we think we're going to be able to do this in September. So the other manufacturers are doing trials, but they just have been a little bit less, they haven't been as bold as to sort of say in advance when they're going to hope to have their data released. For Moderna, their trials looking in slightly older children. So remember, their initial vaccine is only approved down to age 18. So they've been looking at 12 through 17-year-olds going back already early into this year. So I hope that those data might be available very soon.
Thank you. If I could ask one more question. For parents who might be concerned about asthma, is that something they should, be concerned about in relation to getting their children vaccinated?
So before I answer that question, let me backtrack. And so things change so quickly in COVID, during pandemic times that it's sometimes hard to keep up. But let me actually make a correction to what I just said. So Moderna actually has completed their 12 to 17 trial and showed very similar results to Pfizer, that their vaccine was 96% effective in adolescents 12 to 17. However, their data came out came out later, so they haven't had the chance to actually go through an FDA, apply for that FDA emergency use authorization. So I expect that Moderna will come online for 12 and up sometime earlier in the summer. But it's still for those 12 and younger, we're still looking at sometime in the fall. And that's, irrespective of the manufacturer. So sorry, I just wanted to make sure I corrected myself there. In terms of your second question, really, I don't think, we have not seen any problems or concerns with asthma and children getting vaccinated, or adults getting vaccinated for that matter. So certainly, if anything, I would say, people with asthma, especially if they have severe asthma, if anything, this is one more way they can protect themselves from potentially a nasty infection by getting the vaccine instead of running the risk of catching COVID-19.
Thank you so much.
Walter, do you have any questions?
It might be frozen. It's been on that screen.
Pretty
For a little
frozen,
while.
yeah. Well, I have if you have a little bit more time, Dr. Lee, I have a couple that I might send your way. Are there any recommendations for how parents could and can talk to their children about the vaccine after having to talk about coronavirus for almost a year and mask wearing? You know, like, that question is to, if a child has concern about getting the actual shot because of what is in it, as a parent, how do you talk to a young kid about what what it is and you know, the psychology around it, if you would?
Yeah, I think I think there probably are a couple of, of points to emphasize. And, number one, I think really one of the things that can be very reassuring, I think, to young people and children is just a recognition that getting this vaccine, in my mind, really is not any different than getting any of the other vaccines that they've been getting, that they've been receiving through childhood. And we have lots of data now on the vaccine. And just like with any vaccine, as we talked about earlier, a little bit of sore arm, a little bit of fatigue, a little bit of low-grade fever, yeah, that might happen. But look at what you get in return. The ability to potentially start taking the mask off, the ability to start, going on trips again, doing those group activities again, that, all these things that were sort of taken away from our kids already, going on over a year. And so I think that, when we look at what our children stand to gain from getting the vaccine versus what is being asked of them, which is really, in my mind, really not much different than, getting your flu shot, getting, your other vaccines on that schedule that, that parents are used to. So sort of making it, sort of normalizing the experience to a certain extent, and just really presenting, all the benefits that we get from it. And the benefits go beyond just, protection from catching COVID-19.
Yeah, I think that's a great way to look at it. It's a great way to frame it. Like, it's just any of the other shots that they need for any other time of the year or for school in general. And I have a bit of a technical question around the amount of the dosage. I was at the clinic last weekend, and it was the first weekend where 12 and up were at, and I heard this question. I thought it was really great. For young people who are, half the body weight of someone else, are they getting the same same amount of the dose as an adult?
So for 12 and up, the dosage that was studied, or the dosage that was approved, is the same dose as the adult dose. For younger children, in those younger age groups, the manufacturers are looking at different doses as well, specifically to see that, as we get into younger and younger children, who are obviously going to be smaller and smaller, are dose adjustments necessary? And so that is being looked at for the younger kids. For 12 and up, for Pfizer, it is the same dose and it is the same schedule. One area where we have some experience with this is in the arena of flu vaccines. For flu vaccines, we give the same dose all the way down to the age of 2, and the kids do just fine with that.
And I had another question that my colleague wanted me to ask. How can parents be sure that the vaccine won't affect development, given that many children are hitting puberty during this, 13 to 15-year-old window? So do we know anything about that? What has been said around the vaccine and development and puberty?
Yeah, I think that's an interesting question. The vaccine really should not have any impact on puberty or long-term growth or development. When we look at how long these vaccines are sort of stimulating the immune system. We know that that initial burst of activity that really sort of sets the process in motion really only lasts for a day or two. What I'm referring to is for the Pfizer and Moderna vaccines, these use a technology called mRNA technology, where the vaccine recipient's own body basically receives a set of instructions to make a protein that normally is made by the virus. And that's how the person's immune system gets trained to recognize those proteins as foreign invaders and make antibodies. That initial process where the mRNA that gets delivered is providing those instructions to the body only lasts a day or two, and then it sort of goes away. And then after that, it's everything that your body does normally with all the other things that it comes into contact with. Once somebody's immune system has gotten that signal, then it can sort of take it from there. And so from that sense, there really is no sort of medical or scientific reason why we should expect that these vaccines would have any impact on puberty or long-term growth, because the vaccines just really shouldn't have any type of interference with any of those types of activities.
Great. Well, I think that covers a lot of the questions that we had, and this presentation was very rich, and we appreciate you taking the time tonight, Dr. Lee, to come and share all this information with our community here in Vermont. And Karen, thank you as well for helping us facilitate this wonderful conversation tonight. For anyone that is watching on our website, as mentioned, we are running these clinics every Saturday for the next couple of months. And all of this information is around here somewhere on the website. Go up here and register yourself and your family. And also, I think there's something to be said about this around the child and household, right? I mean, for our clinics, we are taking BIPOC folks and household, because we know how important it is to protect the individual. Wei, do you have anything you'd like to add or anything you want to ask before we sign off?
No, thank you all so much for joining us today. This has been wonderful.
I actually was just about to ask that question, Luis, whether when people come with their children, if they haven't already been vaccinated, are you all accepting walk-in appointments if somebody decides they would like to receive the vaccine with their child?
Absolutely. And parents are free to come into the clinic with their child as well. And they can also bring a friend if that feels better for them. So any kind of reassurance, if children are scared of needles, or if adult is scared of needles, everyone is welcome.
I think one thing that should be noted about our clinics that we're really proud of is that we like to dub it as the least medical experience anyone might have. It's a beautiful church. People come up. There's we welcome them warmly, and there's cool music playing. It's a whole vibe. There's a nice patio area. It's a lot less medical, or the way that it's been happening elsewhere around the state. Most important thing is that people come in and get vaccinated, but if people are coming to our clinics, it's definitely more of a barbecue than your shots for school.
That's great.
All right, well, Dr. Lee, thank you again so much, and we'd love to be able to reach out to you should anyone have any questions. If anything we were to receive anything, we'll definitely field them your way via email.
Absolutely, happy to help, and thank you again for having me. And just just as the last word, everybody, please, these vaccines are safe. They're miracles. Let's all go out and get our vaccines and make sure our kids get vaccinated too.
Awesome. Thank you.